Gentlemen, I am Bruno Paulino for Cardiosource in Português, and I have here in Paris the great pleasure to be here with Dr. Salim Yusuf that just presented a very important trial, a very important study in prevention area. And I'll talk something to him. Dr. Yusuf, thank you very much for talking with us. Could you give us an overview about the rationale and the results of PURE study?
The PURE study looks at the use of simple cardiovascular prevention drugs in 17 communities in 626 hospitals, not hospitals, communities, 17 countries. And this is because most previous studies are based on what happens to people after they're discharged from hospital and they're still under medical care. The problem is a few years later, most people are not seeing a physician. So in order to study this, we went into the population and we studied 400,000 people, out of which half were over the age of 35. And of these, 8,000 people indicated they had a heart attack or stroke in the past. When we looked at this, we just were astounded by the results. 80% of people in the world don't even get a single therapy for cardiovascular disease prevention, and practically 90% don't get all four. Now, the situation is also bad in rich countries, but much worse in the poor countries. So what this means is we need systems to make sure that people get this low-cost, effective, safe therapy. Now, most of these therapies are available most of the world. They're inexpensive, but what we don't have is a system of delivering it. In fact, the biggest cost of secondary prevention is the cost of going and seeing a doctor. So we may need new systems where people who aren't physicians look after patients for cardiovascular disease prevention. And these could be nurses supplemented by just university graduates or high school students using set criteria, and they're trained. And then when there is difficult cases or side effects or complicated cases, they are referred to the physician. This way, 80 to 90% of the people can be managed without a physician. This is important because this was the way that in sub-Saharan Africa, HIV and AIDS was dealt with. In poor countries like India, childhood and maternal mortality was dealt with. And we know most prevention strategies are not done by physicians. It's done by not even non-medical people, like vaccination, and in many countries, TB control is also done by non-physicians. So we need a new model, and it is the model that will make the difference.
And Dr. Yusuf, do you believe that PURE can be this model, this can be the difference to increase the rates of adherence?
Yeah, I think you see, when people have to take 4 drugs separately for life, they wonder why they should be taking it if they're healthy. So if we can put them into one pill, it makes it easier for them, and it makes it easier in reducing the cost. So the polypill could be part of the solution. It's not the whole solution. I think the whole solution is changing the system as a whole. Okay? Good.
Okay, thank you very much for talking with us, doctor. Thank you.
Thank you.